Dottie Dorion came up to me and we were talking and said something about what you're going to do in your retirement. I said, well, I'd like to do something for people. Be nice to have a clinic that we could do for free. And she said, well, I've been thinking about that too.
So then I told him about volunteers in medicine, and he seemed quite interested.
I really got serious, and I called Dr. McCollum, who has the idea of volunteers in medicine. Was most helpful. He was a wonderful man.
It took us well over a year just to even find the building, the old Paulus Music Building here. This building had been vacant for years and years. We started figuring out how we were going to renovate it. And then one night, a young man came to one of our small gatherings, board maybe, and came in a wheelchair and said that he understood that we were going to make this into a clinic and he wanted to take charge of all the construction of it. But anyway, West Westmoreland with Jaguar Builders came in and he took over the management of the whole entire place. And he had most everything donated.
I spent the next probably 3 or 4 months going to every doctor's office I knew and everybody I knew and scraping up tables, exam tables. Went to St. Vincent's Hospital and bought chairs and tables that they weren't using. We had just an enormous amount of donated materials, and so the cost of opening up as far as equipment was concerned, very, very small.
Everyone was upbeat because this was a culmination in a way of everything that we'd been talking about the year before. So it was a happy time for everybody. There was a crowd of people here.
We felt so rewarded that particular day that finally we had made it, and there were ups and downs like any project.
We weren't sure what was going to happen because everything was disarrayed. We weren't finished inside really to take too many people in. It was just sort of half finished. And so it was just sort of bedlam out there. But we made it through that, and then everything sort of smoothed out. But the beginning was a little tight.
And it was wonderful because Jack McConnell, the founder of all the volunteers in medicine clinics, he was here. All the dignitaries were here. And for the first time, I actually had the feeling that people knew what we were doing.
I think other milestones came when we got volunteers to come, both physicians and nursing personnel, to come aboard and give us the volunteer help we needed. That reached the climax about 2 or 3 years later.
Our students come here frequently. They come here a lot, and they're able to really make an impact in the amount of care that we provide to patients. But one of the best parts of it is really what it's done for our students. And I didn't expect this. I didn't really know how important it would be for our students to be here, because we're providing care to subsets of people in Jacksonville that provide such essential services like food services, health care, child care, health and beauty, who just don't have access to health care insurance. And so our students have had the opportunity to help those people and understand the situation that they're in. It's been wonderful, just wonderful.
We made do here, the very best we could, but we have outgrown it. And we appreciated having been here all this time, but we're looking forward to it. We need a lot more space than we have now.
There's so much to be excited about. We will be able to serve more people. We'll be able to have more volunteers. We'll be able to provide more one-on-one education and counseling. We can have some innovative meetings. There's just a lot that's going to happen in our new space, and I'm just really excited and thrilled to be a part of it.
Wow. This really is an opportunity for volunteers in medicine to increase the number of people we see. which is why we exist. Kudos to board members over the years who have worked hard, who have brought the right people into the mix to help us continue, because without that kind of leadership, couldn't happen. I have to give credit to our CEOs. Jennifer is our current CEO, and she has done a formidable job in leading the agency. We've had others who during their season also did the same, and so that has kept the organization going. Our sponsors and our donors, my goodness, it takes money to run a healthcare agency, and we have had solid, ongoing, committed sponsors and donors who have given because they value what we're doing. And I have to say, our volunteers, when you look at the people who come, we've had a volunteer who's been with us almost 20 years. Now that's commitment. So those volunteers who come, doctors, nurses, regular citizens who just come and answer the phone and do qualifying, those people are the ones who have made it all possible over these 20 years. So we're indebted to all of them. We're thankful to all of them. And this is the fruit of their work.
Just the parking alone would be a great asset. The bus runs right by us, so if you need to come on a bus, you can come on the bus. I think this is going to be a wonderful spot. I'm excited about what we've done. I hope we fill every room. And if we do a job right, we will.